Hello everyone, welcome to our radiology channel where we meet occasionally to discuss few interesting cases. So let's keep continue this trend. Today's case is tracheoesophageal fistula, but this is not a congenital tracheoesophageal fistula case. This is a case summary of 2-year male child who have complaint of cough, difficulty in eating with regurgitation of food. When we do X-ray in this child, we find coin stuck in esophagus. We have plain X-ray AP view. In that, we see a circular coin stuck in its esophagus. This is a plain X-ray AP view in which we can see circular coin stuck in its esophagus. This coin is well visualized in lateral X-ray view, but unfortunately that I don't have. This is the X-ray after the removal of the coin, where we don't see any foreign body. So this coin was removed under anesthesia by flexible endoscopy. After the procedure, CT scan chest with neck was performed. In CT scan, we see no foreign body, that is coin, in esophagus or trachea. But we can see here evidence of multiple air foci of air attenuation in a soft tissue between this trachea and esophagus. However, no complete definitive fistulous tract seen in between this trachea and esophagus. So this is due to because of that coin which is placed in esophagus since 3 months, that removed with the help of flexible endoscopy. So it is not a case of congenital tracheoesophageal fistula, but it is a case of partial tracheoesophageal fistula. As we see here, this is the air foci in soft tissue in between the trachea and esophagus that causes the clinical symptom in patient, this 2-year patient who doesn't eat properly and regurgitate the food since 3 months. So now let's see the lung window of this patient. We can see collapse and consolidation in the basal segment of bilateral lower lobe, and we can see minimal amount of hypodense collection. Since this is a lung window, hence we cannot see such a clear hypodense fluid here, but there is a minimal amount of hypodense collection in left pleural cavity. So, in a nutshell, the story is that this is the case of iatrogenic partial tracheoesophageal fistula due to long-standing coin in esophagus that causes consolidation and collapse in bilateral basal segment of lower lobe with minimal left pleural effusion. Usually, this tracheoesophageal fistula patients clinically present with drooling of saliva, dysphagia, vomiting, chest pain, and respiratory distress. Urgent treatment usually necessary in these cases to avoid further complication, such as definitive tracheal esophageal fistula tract, esophageal ulceration, and mediastinitis like things. Most common site for foreign body seen in cricopharynx because this is the narrowest area. So this is the case. One thing, make sure that this is not a case of congenital tracheoesophageal fistula, but this is a case of iatrogenic partial tracheoesophageal fistula in a 2-year male child patient who have eaten or swallowed a coin 3 months back. So thank you for watching this video. Kindly subscribe, like, and comment on video. Be happy and keep learning, and best wishes. Thank you.